Hey, welcome to Plants and My Therapy, but today we're not talking about plants. Today we're going to be talking about and how further quarantines and lockdowns will be ineffective. Taking reference from the Spanish flu of 1918, I'm going to focus on two cities. The city of Philadelphia decided that it was best to have a parade to boost people's morale during World War I. Thousands of people crowded the streets to witness this parade, and within 3 days, all the hospitals were overflowing with sick patients. This overwhelmed the health system, and many people died as a result. In the city of St. Louis, they issued a quarantine which lasted about 4 weeks. People were threatened with arrest. So people did get sick with the Spanish flu, but St. Louis's healthcare system wasn't overrun, and they were able to care for their sick in a better fashion. Unfortunately for 2020 was an election year, and it was made political. It was smart for the president to shut down travel from Asia and Europe. It was also smart that he encouraged quarantines and shutdowns, but this should have lasted only a month. During this time, the government should have put aside their differences and worked for the public's best interest. In the first week, the government should have come up with a plan. By the second week, they should have implemented the plan, and by the fourth week, the plan should have been fully operational. This should have never been made political. Now, the government is the government, so that's a whole different story. But the reason why quarantines and further lockdowns will not be effective is people do not have the same understandings of why quarantines are in effect, and people need to survive. People need to work. People need to earn money, and people need to buy food. I'm going to be talking about one particular family that affected an entire community because of their, let's just say, educational level and economic status. In early March of 2020, there was a death in this family. Since Hawaii was under lockdown and quarantine, people couldn't gather in large groups. So this family gathered in a private home to mourn the passing of their loved ones, and involved 5 overcrowded households. Out of the 5 families, there were about 35 to 40 members, and they all tested positive. About 12 of them were admitted to our hospital, and I had the pleasure to have to care for them. I explained to them the importance of their younger members who weren't hospitalized must quarantine themselves from the rest of the community. But this was rejected. This family claimed that the younger ones had to work to pay bills to buy food. It was explained at length that these people would be spreading and putting other people at risk. This information was rejected. As time moved on, it was reported to me that this family was collecting money to send for family members who were on the West Coast, in California, Oregon, and Washington. I explained to them that the state currently was in quarantine, and that these family members from the mainland would have to be quarantined for 14 days at their residence, and everyone at their residence tested positive for. I tried to discourage this family from sending for their families from the West Coast. This information was rejected. I alerted the staff not to give money to these people. The hospital initiated a no visitors policy, but somehow this family got the money, and family members from the mainland came to Hawaii and were quarantined in their house. Over the next few weeks, many of the members of these families who were initially hospitalized succumbed to. And as frustrating as these people were, it's hard to care for people without actually caring for them. I didn't want to see them gasp for air. I didn't want to see them go on a ventilator. I didn't want to see them turn off the ventilator. As many of these family members got better and was discharged home or didn't, there were 3 sisters left. Each time I went into the room, I had to prepare myself. I had to remind myself that it's not my place to judge, and I have to focus my mind to give these patients the best care that I can. When I entered one of the sisters' rooms, she was crying, so I asked her if there was anything I could do. She declined as she continued to tell me that one of her family members, one of them that she sent for from Washington, had gone home because he wasn't feeling well and had died from. I had to grit my teeth as I listened to her to support her emotionally, but I was angry. The family member that they sent for from Washington had to be quarantined in their home where everyone tested positive and then wasn't feeling well, so he flew back home, which means everyone on that 6-hour plane flight back to the mainland was exposed to him. That woman later died that week, but I know that I did not allow my personal feelings to get in the way of giving her the best medical treatment that I could. Her sister wasn't doing as well, and we were getting her ready to be transferred to the ICU. She needed to be vented. Usually when people go to the ICU with and need to be vented, they don't leave the ICU. Well, they leave, but to a mortuary. Her daughter called me on the phone screaming. I explained the situation thoroughly. I had to break it down to almost an elementary school level of explaining. She demanded that her mother needed to be with family. I explained to her that her mother is very infectious. She threatened that if I didn't allow her family to come and visit her mother, that they would take her mother out against medical advice. I told her that I can't allow her family, who already tested positive for COVID, to come into the hospital because it'll put the staff and the rest of the patients at risk. So as usual, I went to administration to help me. There was nothing that we could do to stop them. The daughter came and took the patient to their home where their family had already gathered in support of this dying patient, exposing more people who then will turn around and expose more. I'm not sure if it's cultural or educational, but these people are the reason why we need laws. But these are not the only people who don't understand why there is a lockdown. My granddaughter graduated from Hawaii's National Guard Youth Challenge Academy, and the military was very orderly and cautious. All the parents of the graduates had to line up and remain in their cars, and we watched the graduation ceremony on our iPhones. Then we would go to the first gate to pick up their belongings, the second gate to pick up their paperwork, the third gate to pick up the fourth gate to pick up various memorabilia. While in line, I was parked on the side of the road by a park. They had a huge tent set up. I asked if they were part of the National Guard, and they said no. They were taking a break from the quarantine to have a big party to celebrate the graduation of their daughter, and then they're going to go back on quarantine. They had a huge tent set up with a whole row of table with food, picnic tables, and there were about 20 people there already, but it was obvious that they had planned for a larger crowd. After I picked up my granddaughter, and the National Guard did a wonderful job at keeping everything separate and maintaining social distancing, I had to drive past that park, and they had several tents set up with a whole bunch of people waiting to celebrate the graduation of their kids from that program. A quarantine will not work if you take a day just to have a humongous party and then go back into quarantine. This is why further quarantines or lockdowns would not be effective. People have become accustomed to the quarantine and lockdown restrictions. They've become complacent. People cannot afford to be out of work for a year. People will choose to go back to work even if they're sick because now they're heavily in debt and need to feed their families. Public service announcements that explain the reasons for quarantine or lockdowns will not be effective because some people cannot grasp the concept. On one side, the government should have never weaponized for politics. On the public side, there will always be a large enough member of society that would not understand any amount of education that you try to give them. And forcing people to go in great debt will only make them desperate, and they will find a way to get around these laws or quarantine efforts. This is just my opinion on why quarantines and further lockdowns will be ineffective. I didn't even mention the damage to our economy, the loss of businesses, and the greater accumulation of debt that some people would never be able to pull themselves out of. Take care and be safe.